So I'm going to gather my supplies. Hi, how are you? My name is Andrea. I'm going to be your nurse for today. Can I please have your full name and date of birth?
Robbie Ruiz, September 2nd, 1993.
Okay, good. I'm going to check your bracelet, wash my hands, and pull the curtain for privacy. From a scale of 0 to 10, what is your pain today?
0.
Good. Okay, so today what we're going to do is we're going to do a head-to-toe assessment. Is that okay with you? Good. Okay, so first we're going to start off with the general survey. So what I'm going to start off is by noting my patient's hygiene, the nutrition, and the body position. Everything seems to be within normal limits. And I'm going to also assess your orientation. So can you please tell me your full name again?
Robbie Ruiz.
And do you know what time it is or what day?
11 p.m.
The year?
2019.
Okay, and where are you at?
Maples.
Okay, patient is alert oriented times 4. So we're going to move on and do the skin integrity. So I'm just going to be noting on all body parts. I'm just going to be noting the color, the temperature, and the moisture of my patient. So we're going to move on and do the vital signs, which I already took previously. So blood pressure 126/80, respirations 816, and O2 stat in room air is 97%, temperature 98.9, pulse 72, and you stated 0 out of 10 pain level. Okay, so that concludes all the vital signs. We're going to move on and do the head and sinus assessment. So I'm just going to go ahead and palpate your head and making sure I'm looking for any skin breakdown, any baldness, any lice, or anything else. Head is normal cephalic. So I'm going to move on and do the sinuses. Just let me know if you feel any pain or tenderness when I palpate your sinuses.
No.
Okay, good. So now, after concluding the head and sinuses, we're going to move on and do the cranial nerves. Okay. So we're going to start off with cranial nerves 1 and 2, olfactory and optic. So olfactory, please close your eyes, close one nostril, and tell me what you smell.
Cinnamon.
Good. Okay. And then close the other nostril and tell me what you smell.
Chocolate.
Good. Okay, perfect. So if you can please open your eyes and cover one eye with your hand. How many fingers am I holding up?
2.
And then the other eye, how many fingers am I holding up? Good. Okay, so cranial nerve 1 and 2, olfactory and optic are intact and within normal limits. So we're going to move on and do cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. So for this, I'm going to ask you to please remove your glasses. We're going to check the pupil dilation. So please look straight ahead. Looking at the pupil dilation. Making sure both dilate at the same time. Good. Okay, pupil gauge is about 3 millimeters, and I'm going to have you follow my pen light as well. Don't move your head, just move with your eyes. Good. Side to side, and to the center. Good. Okay, pupils are equal, round, reactive, and reactive to light and accommodation. Okay, so pupils 3, 4, and 6, oculomotor, trochlear, and abducens are intact and within normal limits. You can go ahead and put your glasses back on. Now we're going to move on and do 5, 7, 8, and 11, which is trigeminal, facial, acoustic, and spinal accessory. So for 5, I'm going to please have you close your eyes and do the sensory test. And please tell me what side of your face I'm touching. And what side? Okay, good. And then now what we're going to do is we're still on trigeminal. I'm going to have you to clench your teeth, please, and feel the TMJ. Perfect. Okay. So now we're going to move on to cranial nerve number 7. Can you please smile, frown, raise your eyebrows, and bubble your mouth. Good. Okay. So now with number 8, I'm going to have you close your eyes and repeat back what I whispered to you.
No. Chocolate.
Okay, perfect. And last cranial nerve is, you're going to shrug. Oh, you can go ahead and open your eyes, shrug, and against resistance. Good. Okay, now move your head against resistance. Against resistance. Okay, perfect. So now we're going to move on and do cranial nerves 9, 10, and 12, which is glossopharyngeal, vagus, and hypoglossal. 9, we're going to go ahead and do pen light. So just say ah for me, please. Good, so I'm just noting the uvula in the back, make sure it rises and that it's in symmetrical and in the middle. And then for number 10, can you please swallow for me? Good. And can you say my name is?
My name is Robbie.
Good. Okay, so I'm just noting any hoarseness of the voice. There is none present, and then for the last one, I'm gonna use the depressor. And can you please move against resistance to the side and to the other side? Okay, good. And now I'm gonna go ahead and note that cranial nerves 9, 10, and 12, which is glossopharyngeal, vagus, and hypoglossal, are intact and within normal limits. Now I'm gonna move on and do the oral inspection. So if you could please open your mouth again. So using the tongue depressor and my light, I'm just noting the mucous membrane, making sure it's pink, moist, and no lesions, no open wounds, and no cavities, and everything seems to be within normal limits. Okay, so then after that, we're gonna go ahead and move on to the neck and the lymph nodes. I'm just gonna palpate your neck. And touching the trachea, making sure the trachea is in midline, and I'm going to go ahead and palpate the lymph nodes as well, and let me know if you feel any tenderness or pain under the chin. Do you feel any pain at all?
No.
Okay, good. So that concludes the neck and lymph nodes. Now we're going to move on and do the carotid arteries. I'm going to go ahead and palpate again. Okay, both sides are equal +3 bilaterally, and I'm going to go ahead and listen with my bell. And when I do, please hold your breath. Go ahead and hold your breath. And with this, I'm going to go ahead and hold your breath. I'm looking for any bruits, and there seem to be none present, so everything seems to be within normal limits. So now we're going to go ahead and start with the upper extremities. I'm going to be looking at your arms, the color, the temperature, and the moisture. They are dry bilaterally, warm to the touch, and skin color matches ethnicity. And I'm going to go ahead and check the radial pulses. Both seem to be +3 present bilaterally, and then checking the skin, the capillary refill, which is less than 3 seconds, which is good and normal. And then we're going to move on and do the motor strength. So if you could please squeeze my fingers, good, and flex your elbows and pull, good, and then push down while I push up, perfect. And then now we're going to do range of motion, so if you could please raise both of your arms up, good, and now adduct, good, and then flex both of your elbows, extend, go ahead, and flex, extend, and hyperextend. Okay, good, so motor strength is +4, so is range of motion, and everything seems to be within normal limits. So I'm going to go ahead and move on to your chest and inspect your chest and skin turgor as well. Chest is normal, symmetrical, and skin turgor is normal as well. There's no signs of tenting. So we're going to go ahead and move on to your heart sounds and lungs. So if you could please sit up for me. I'm going to go ahead and listen to your heart sounds. Starting with the diaphragm, I'm going to go ahead and start at the aortic, pulmonic, which is the second intercostal space, Erb's point, tricuspid, and the mitral valve. In the mitral valve, I'm going to sit here and listen for a full minute. And the apical pulse I got, which was 70, and then I'm going to go back and do all 5 points again with my bell and making sure I'm listening to S1 and S2 sounds. Okay, so that concludes the heart sounds. I'm going to go ahead and move on to the lung sounds. I'm going to do the interior lung sounds, and I'm going to listen to 12 spots. Using my diaphragm again. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. Good. Okay, so if you can please turn around so I can do the back side, and in the back I'm going to be listening to 16 parts of the lung, 16 points in the lung. Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Okay, and lungs are clear and present, and no signs of wheezing or bronchitis or any of that, and they are within normal limits. Okay, so now we're going to go ahead and I'm going to have you lay down so I can assess your abdomen. Good, so we're going to start off with inspecting the abdomen. I'm just looking at whether it's flat, round, step forward, convex, and he has a flat abdomen, and I'm gonna move on and auscultate as well. So starting off with the diaphragm, I'm gonna start at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and abdomen sounds seem to be normal active, not too hyperactive or not too hypoactive, and are within normal limits. And now we're going to move on to percussing the abdomen, making sure, noting that I listen. Starting off at the right lower quadrant, going again to the right upper quadrant, left upper quadrant, and then finishing off at the left lower quadrant as well. Making sure I know of any tympanic or dual sounds which are normal. Okay, everything seems to be within normal limits. And then the last thing I'm going to do is I'm going to palpate lightly. Again, starting at the lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and asking the patient, do you feel any pain or tenderness?
No.
No? Okay, good. Everything seems to be within normal limits. So from that, I'm going to move on to the genital assessment, making sure there is no odor, no discharge, abnormal discharge. There are no catheters, no tubes present, and everything seems to be within normal limits. So I'm going to go ahead and move on to taking the femoral pulse, and both are present +3 bilaterally. And then I'm going to move on and do the peripheral pulses as well, doing the popliteals one at a time. Both are +3 bilaterally, doing the dorsalis pedis bilaterally as well, present, and the posterior tibialis as well. So now we're going, since I'm here already, I'm going to assess the motor strength. So if you can please push and push up. Good. Okay, so motor strength is +4. So now I can have you turn back around. So I'm going to have you stand up, and we're going to do the lower extremities. And, oh, I'm sorry, can you sit back down? One more thing, I'm just going to be checking the skin, the color, and the moisture of the legs as well. It is warm to the touch, color matches the ethnicity, and temperature is warm and dry bilaterally as well. So you can go ahead and stand up now as well. So now what we're going to do is we're going to flex the knee, the hip, flex the knee. Good, flex the ankle. Extend. And now with the other leg, flex the hip, flex the knee, and flex the ankle, and extend. Good. And then with now what we're going to do is we're going to do the eversion, inversion, eversion, inversion, internal rotation, external rotation, internal rotation, external rotation. Good. Okay, so now if I can please have you walk across the room and walk back. Now I'm going to stand behind you, scoot up a little. I'm going to stand behind you and perform the Romberg test, making sure I stay here for at least 20 seconds, closing your eyes and checking if there's any swaying or imbalances, and there seems to be none present, so he passed. You can sit back down. So now I'm going to go ahead and document everything, making sure I note all my findings, and that I also note that I communicated appropriately with the client.